For doctors or practices that don't have telehealth capabilities, what's the best or quickest way to get started for them?
Well, I'd say that most, in a relative panic without a lot of foresight, picked up the most widely accessible, least expensive, and available platform that they could without really much thinking about how that may really evolve as a part of their practice. So I'd say that for the most part, on the first hand, you had people picking up Zoom, DoxyMe. There are a whole bunch of platforms that are readily available, are useful, but aren't necessarily ones that integrate into their kind of practice, their EMR, or a real long-term perspective on what you want to do with telehealth as you evolve from the COVID experience. I think that physician practice is changed forever, and in a good way for patients. In a lot of ways, whether it be sustaining a medical home, whether it be eliminating the difficulty of taking time off from work, traveling, or sitting in a waiting room, whatever it might be, there are many things that are really easily taken care of through a telehealth visit. And I'm very happy that happened. So you ask also what other let's say resources might they have to find out about where they could get a good platform. If they're willing to take the time to think about it and explore and do some research, the AMA has a great set of resources. Our telehealth initiative has created a lot of resources through the Texas Medical Association. We have just released something called the Telemedicine Implementation Playbook, which is an AMA publication that is available online to all physicians and really does have a lot of information. So it's TexMed, the Texas Medical Association spent a lot of time, resources, the AMA, and we've been working with the Florida Medical Association and the Massachusetts Medical Society to further develop the resources that can really be helpful for physicians and other state medical organizations to help their physicians implement telemedicine and to evaluate vendors and what the pluses and minuses might be.
And these resources are all aggregated on the Physicians Foundation Telehealth Initiative's website, is that correct?
These resources are best accessed through actually the texmed.org website, which is the Texas Medical Association, at the AMA-ASSN, American Medical Association website. And they are linked through our website. We don't maintain that specific set of resources on our website. There are constantly evolving issues around this. As people use and implement a lot of the tools, they discover new ways of making it work for their patients, for their practice. And so the rules have been, let's say, more or less loosened significantly around it from CMS and most payers. There will be some, I think, let's say, winding in, some reeling in of some of that freedom that we have right now. So I think going to those websites, learning about what parameters they might be concerned about, whether it's the HIPAA compliance, whether it's condition-specific templates, whether it's the relationships that vendors have had with other practices, or their reliability to service when there are issues that need to be addressed. These are all things that we have some data on, and we're accumulating more data on, and so these are things that change day to day that we can help doctors understand and navigate this quagmire of sorts.